A runner is coming around the last stretch of a 400-meter dash. This is it. It's time to give it their all. As the runner reaches the finish line, they feel a slight pull in the back of their leg, and just like that, they've torn their hamstring in a matter of 15 seconds. Now, their next few months will be spent in a physical therapist's office. A physical therapist's job requires just what the name states, hands-on therapy. As stated in the Occupational Outlook Handbook, a physical therapist helps injured or ill people improve movement or manage pain. The importance of this profession starts with the origin, full classification, techniques, and benefits of the practice. Hi, my name is Angela Durnan, and today I'm going to tell you how a physical therapist is not only a helper, but a healer. Medical practices have been performed since prehistoric times. It was thought that diseases were formed by supernatural powers. So many methods such as skull drilling, herbal concoctions, and ritual dances were used in search of healing for the individual. As time has passed, research has evolved with the help of multiple physicians to understand that diseases are indeed caused by natural phenomena. There have been many other medical professionals along this journey who have specialized in certain portions of the body to expand the knowledge of the human body itself. Because of them and the continuation of studies and practices, the general population is living much longer and the number of elderly is increasing. The need for healthcare providers is continuously growing. As shown on the U.S. Bureau of Labor Statistics webpage, employment for healthcare occupations is projected to grow 15% from 2019 to 2029, adding about 2.4 million new jobs. As more diseases are being discovered and outbreaks occur, medical professionals are essential in our current world. According to the American Physical Therapy Association, physical therapists formed their first association in 1921. But practices were dated back in 1813 in Sweden. As for what a physical therapist's job entitles, physical therapists are movement experts who optimize the quality of life through prescribed exercises, hands-on care, and patient education. A PT is usually required after surgeries, fractures, sprains, and strains in order for the patient to recover successfully. There are 9 major types of physical therapists. Pediatric therapists focus on young and developing bodies. Common focuses for this specialty are development delays, cerebral palsy, cystic fibrosis, scoliosis, and brain damage. A pediatric PT's job is not only to treat their patient, but help educate the guardian on how they can contribute to their young one's recovery. A sports therapist is one of the first responders when an athlete is injured. Their education and practices are centered on common athletic injuries like ACL tears, concussions, tennis elbow, hip flexor strains, and shoulder injuries. For sports therapy, patients are likely athletes who want to return to peak performances. So restoring muscle strength, improving speed, quickening reaction time, and improving agility are often areas of focus. Women's health therapists are directed towards female-oriented conditions. Physical therapists in this specialty can work to treat conditions such as pelvic pain, osteoporosis, and lymphedema, while also providing prenatal and postnatal care. Geriatric therapists work with elderly patients to alleviate pain from arthritis, osteoporosis, and general joint stiffness and soreness. As the body ages, its function weakens. So it is important that people of higher age are receiving the care they need. Clinical electrophysiology is the practice of using electrotherapy and electromyography, or EMG, to treat patients. An EMG determines the electrical activity in a muscle and can view the health of a muscle and nerve cell. These advances in technology are so critical when it comes to treating and detecting internal damage. Electrotherapy can help prevent blood clots, facilitate wound healing, relax muscle spasms, improve blood circulation, and alleviate pain. A cardiovascular and pulmonary therapist specializes in heart and lung health. Whether it be a patient with a heart condition, rehab for a cerebrovascular accident, or someone in search of strengthening their heart, this is the type of therapist who treats them. In cardiac rehab, physical therapists help patients build their endurance through exercise, while also teaching patients how to reduce stress and manage their conditions. For those with breathing issues, physical therapists teach these patients breathing exercises, work to strengthen muscles and endurance, and provide education on long-term management of the condition or disease. Nervous and spinal system conditions are looked upon by a neurological therapist. They can be used in rehab for someone with a brain or spinal cord injury, multiple sclerosis, sciatica, neuropathy, fibromyalgia, and cerebral palsy. The brain and spinal cord are crucial components of the human body, making this position of high importance. Orthopedic therapists are the most common type of physical therapists. They deal with the treatment of bones, muscles, ligaments, tendons, and joints. Methods such as stretching, exercise, strength training, hot and cold application, and electrical muscle stimulation are used to treat the patients. The last type of PT is an oncology therapist. This is a professional who specializes in rehab of cancer patients. Cancer is one of the most terminating conditions on the human body, and because of that, it is important for patients to regain their strength once again. Physical therapists work with cancer patients to help them feel more comfortable, increase their aerobic capacity, lose weight, improve memory, and strengthen any weakened muscles. Approximately 7 years is how long it takes to become a PT. A student must earn a bachelor's degree in a health science, such as biology, psychology, biochemistry, or physiology, and meet all prerequisites for the Doctor of Physical Therapy, or DPT, program. This is a 3-year program involving labs and clinicals, as well as structured classwork. Schools like the University of Iowa, University of Pittsburgh, and the University of Southern California are amongst the most elite colleges to offer this program. After that, it all comes down to passing the National Physical Therapy examination, and then a PT can earn a well-deserved license. As said in the Occupational Outlook Handbook, the median annual wage for physical therapists was $89,440 in May 2019. But pay varies depending on the area of on the location of work. Bigger cities offer more compared to rural areas. Nevada, Alaska, and New Jersey are the top 3 states to offer PT pay, ranging from $97,000 to $107,000. Employment of physical therapists is projected to grow 18% from 2019 to 2029, much faster than the average for all occupations. Like other medical-related professions, the need for this job never slows down. Numerous conditions restrain patients from moving. Sufferers of Parkinson's disease, lupus, Lyme's disease, and other nervous system conditions are in need of a PT to maintain a healthy lifestyle. The significance of this field will never decrease, as it plays a crucial role, especially in aging bodies. There are multiple techniques physical therapists use to ensure good health and satisfaction of their patients. The scope of practice for physical therapists says there are 3 components: professional, jurisdictional, and personal. A professional point of view is backed by years of education and hands-on experience. Practices come straight from the book. Jurisdictional is based on what the state license inquires. Depending on where your job is located, there could be different rules and limitations. As for the personal standpoint, this is performed by personal decision of the physical therapist themselves. Exercises are determined by extending knowledge of the pertaining injuries from a PT. Each technique, as well as physical methods, play an important role in the road to recovery for the patient. To allow the muscles to be more vulnerable when being treated, a physical therapist will often suggest the patient apply heat while focusing on the area they are treating at home. It has been shown that thermal compression expands blood vessels, permitting larger oxygen and nutrients intake. It is important that patients expose the area they are working on to heat before doing any drastic stretching, for it is said that heat increases range of motion and decreases pain in joints. With that, following up a PT session with a cold compress helps the muscles recover. It prevents muscle spasms and increases pain threshold. Such a simple gesture of using hot and cold application can prevent larger problems like micro tears and strains. The most common method used for patients is stretching. Symmetry Physical Therapy shows that there are 3 main stretches a PT uses: ballistic, static, and dynamic. Ballistic stretching involves rapid bouncing motion to stretch a muscle to its maximum length. Though this method is risky, for it can be dangerous to the connective tissue. Static stretching involves stretching the muscle until a gentle tension is felt, usually for 30 seconds. Dynamic stretching involves stretching the muscles with motion and gradually varying the speed and distance of the movement. All these stretches play some role in a stronger muscle. Kinesiology tape, such as this, is one specific mode of treatment that a PT may use. It involves placing strips of special tape on your body in specific directions to improve your mobility and support your muscles, joints, and tendons. Often, kinesic tape will come second to stretching, but has many benefits as well. It is said to improve the interaction between the skin and the underlying structure. It is a flexible material that will help with circulatory motion and reduce pain. Medication can also be prescribed by a PT, mainly over-the-counter ones though. So now I'll show you a video that explains how KT tape works.
Kinesiology tape, such as rock tape, helps reduce swelling by creating a biomechanical lifting mechanism which slightly lifts the skin away from the muscles. Once the skin is lifted, fluids can more easily drain away from the injured area. Often, rock tape will reduce swelling by up to 50% in less than 12 hours. Once the swelling has been removed, nerves are no longer compressed and the pain greatly diminishes. Additionally, rock tape can also accelerate blood flow into an injured area. The more blood circulating in an injured area, the faster the injury can heal.
Lastly, some physical therapy-based equipment can be used to strengthen muscles and relieve pain. Balance devices like beams and balance pads are used for patients to build their stability. Cervical, lumbar, and thoracic pivots are used to adjust and strengthen the spinal region. Upper body equipment like a biodex cycle can be used for those with limited lower body use. Other common items are weights, exercise balls, resistance bands such as those, treadmills, elliptical, or vertical climber. All of these resources are used in a productive manner in order to achieve progress in the patient. Going to a physical therapist after a surgery or injury is one of the most beneficial moves a person can make. It reduces and eliminates pain, can prevent surgery, improve mobility, help recover from a stroke, improve balance, and prevent falls, manage diabetes and vascular conditions, manage age-related issues, manage heart and lung disease, and help with postpartum. It helps with recovery and better long-term health. Seeing a physical therapist is the more adequate choice of recovery.
Kinesio.
Before I conclude, I'd like to touch base on my mentor. When looking for a mentor, Abby Hageman was brought to my attention by a fellow co-worker of hers and a classmate of mine. Abby is a restorative therapist at Maple Crest in Fayette, Iowa. Abby has talked to me about how she plans and executes a therapy program while working with the head PT there. She has been working in this position for 2 years now and is an essential asset to the elderly community. So, when discovering physical therapy, it is important to learn where it originated, the day-to-day life of a physical therapist, their techniques, and the benefits of their treatment, to get a full overview of this type of work. After 7 or so years of hard work, studying and attending labs and clinicals, a PT earns a well-paid and time-managed job. Next time physical therapy is needed for either a minor muscle pull or a torn ACL, remember the journey they took in order to help those in need. Here are my citations. Thank you for listening. I'm ready for questions.
How did you pick this topic?
That's what I plan on being. That's what I'm going into college for.
Was there something that kind of kicked you that direction? Was it this Abby or?
No, I like the health field, but I don't like the blood. So I thought this would be a better option.
Have you gone to physical therapy?
Yes.
Have you chosen where you want to study?
Iowa, University of Iowa.
And about your mentor, were you able to shadow her, or was basically
Yes,
through?
I'm gonna set up a job shadow with her, but so far we've just been texting back and forth.
Sure, it's a little more difficult with the COVID and things
Yeah.
to be able to do that.
Yeah.
Yeah. Were you surprised with the number of different physical therapists? I guess I didn't even realize it.
Yeah, I didn't either until I researched it. Yeah.
And is there one that you particularly care for?
Orthopedic. Yep.
Okay.
Any other questions? Thank you. Way to go. The time was 16:15.